Hello, Dr. Ross Walker, and welcome to Miskawaan Cardio. I'd like to talk to you about what we call the 5 primary risk factors for heart disease. Number 1 and most important is hypertension. That's high blood pressure. I'm going to drill down into each of those in an individual podcast. But hypertension is really more important than cholesterol, and it's our number 1 risk factor, and especially when you get over the age of 60. As the arteries stiffen up, the blood pressure goes up. So hypertension, number 1. Number 2 is some sort of cholesterol abnormality. It's not just having a high cholesterol, that is simplistic nonsense. It's looking at the whole profile and other factors that go with that. And I'll talk much more about the importance of cholesterol in an individual podcast. Number 3 is cigarette smoking. Now, I just don't know why people continue to smoke. Everyone knows it's bad for you. So if you're listening to this and you're smoking, please stop. Not for my sake, but for your own sake. Number 4 is what we call insulin resistance leading to diabetes or pre-diabetes and all the other manifestations. And I'll talk more about insulin resistance on another podcast, but it's an extremely important risk factor for heart disease. And number 5 is basically picking the wrong relatives. It's called bad genetics. And as I've said before in previous podcasts, all heart disease, all cancer, all Alzheimer's disease, all modern diseases are genetically based, but it's your genes that loads the gun, then your environment that pulls the trigger. So if you have a family history of someone who's had a heart attack, a stent, a bypass, a stroke, peripheral vascular disease, or have blockages in their legs, especially before about age 65, then that is a strong genetic risk factor for heart disease. If your father had a heart attack and died at 85, that is not a genetic factor. So you've got to look at when people had the heart attack and where in your family they sat. So if it's your first degree relatives like a parent or a sibling, then that's more significant than if it's an uncle. But still, family history is vitally important in the generation of those 5 things, which are high blood pressure, cholesterol abnormalities, cigarette smoking, diabetes or tendency to diabetes, and family history. Thank you.
Miskawaan, Visionary Health.